I am Ariel Walker, and I'm a certified nurse midwife. I am from Columbus, Georgia, and I grew up there, graduated from Columbus High School, and then I went to Georgia Southern University, where I graduated in 2014 with my Bachelor of Science in Nursing. In 2015, I started at Frontier Nursing University to obtain my Master of Science in Nurse Midwifery, and graduated from there in 2019. Since then, I have worked in Cordial, Georgia, which is a rural, underserved population area, and I've been a nurse midwife now for 3.5 years. A certified nurse midwife is an advanced practice nurse who goes and gets a master's degree, specifically in nursing, and becomes a provider in women's health. So we provide care all throughout the lifespan. So a lot of people know us just for the labor and birth aspect of the care that we provide. A lot of people come into the hospital and they've never seen a midwife before, and the midwife happens to be on call, and that's who delivers their baby. But we actually do a lot of other stuff, including GYN care, contraceptive care, annual visits. We order mammograms. We take care of women from the teenage years all the way through menopause. So we do a lot more than just the labor and birth portion, although that's the part we're most known for. I have always been kind of obsessed with the birth process. Loved it as a child. I always watched those A Baby Story and pregnancy stories on TLC when I was a elementary school age girl, and my mom kind of was like, that's odd. But I loved it. I was fascinated by the process of birth and that whole change and the transition and how babies come about. And so then when I was in nursing school, I was in ROTC, and we had to do a training program where they would send you to a military training facility for a summer, and you had only done 1 year of nursing school, so you didn't know everything, but you knew something, and you paired with a nurse, and they walked you through what their job was and how it went, and you kind of got to pick the specialty you wanted, and it was sort of exposure therapy. Well, I got to do labor and delivery, and I fell in absolute love with it, and I knew that when I graduated, that's what I wanted to do. Well, at the time, my husband was active duty, and finding a job in labor and delivery as a new grad is not always a very easy task. But emergency rooms are often definitely looking for nurses. So I found an emergency room position, and I actually ended up staying there for 7 years because I loved that too. That fast-paced environment, the constant never knowing what's gonna roll in the door, which actually the joke's on me because the same thing happens on labor and delivery. It's just a different patient population. So when I ended up going to Cordial and had started working there as a midwife, I thought I was just going to be doing midwife things, air quotes, but it was very much the primary care that I had done in the emergency room. So that time developed all of my critical thinking skills and my ability to recognize red flags that don't have anything to do with pregnancy and birth, but definitely have something to do with the overall picture of what we're dealing with. So I loved my ER time, and it definitely led me down this path in a good way and made me a more well-rounded midwife. I educate patients and inspire health in my patients by essentially developing a relationship. So a huge piece of the midwifery model of care is to inspire patients to trust you by developing relationships that they learn that you have their best interest. So I talk to my patients, not at my patients. So I don't tell them this is what we're going to do. I explain all the different ways that we can get there. The analogy that I use for my patients is that I am Google Maps, and I tell you all the different routes to get there, and you're driving the car. So you tell me which way you want to get there, and I tell you, the best way, the fastest way, the safest way, all of those things, and you tell me based on your experience and your opinion which way you would like to go. So the beauty of that in midwifery is that when we get to the labor and birth portion, you have developed that relationship with me, and we've cultivated a mutual respect for each other, and you know that I have your best interest. So when the big bad scary things happen on labor and delivery, which are often completely unexpected and can be very challenging, you trust that we are going to be a team, and that's how I inspire patients to do what is best for them, and also how you take a patient who may not necessarily in another relationship want to do whatever the doctor is telling them to do or whatever. They may do it because they understand that you truly care about them. So that relationship teaches the patient that I really do care about your outcome, and I want you to have the best experience possible. And so those relationships really help patients to educate themselves more, to find resources, and for you to help find resources for them as well. When I'm not at work, I am very busy with my 2 human babies and my 2 fur babies and my husband, who all keep me very busy. We like to explore the mountains. My children love to go geocaching, so we do lots of that. And Greenville's a great place for it, so we love that. We are boxer people, so we've had 2 sets of boxers that are from the same litter, so we're big dog people, love that. And I love to read. I like to try new recipes and cook, and I'm spontaneous and like to go and take my kids and do new fun things around Greenville. To schedule an appointment with me, please use the contact information on my profile page.